Let's move to the last talk from a colleague from CNR, from IASI CNR actually, Daniela is not from IASI, but there are colleagues from IASI. So I give the podium to Daniela. I don't.
Hey, do you see my?
Okay, we see you and we see the presentation. Perfect.
Okay, perfect. Thank you. Thank you. Good evening, everybody, and thank you to Fabrizio for having organized this interesting workshop. Today, I'm going to present an ongoing work I'm doing with some colleagues of the National Council of Research, Federico Papa and Carmela Sinisgalli, and of SapienzaPaolo di Giamberardino. I think that many interesting aspects on COVID-19 has already been stated, so I will not repeat them. And in general, I try to summarize in this slide, there are many aspects that we still don't know about the virus spread, about the medication, the prevention, the immunity, and so on. So I will concentrate on these three aspects. The spread among regions, the unknown percentage of asymptomatic, and the control action, the so-called phase 2. In particular, there are two main research lines I'm doing this period, and let's start with the first one. In particular, the modeling of COVID-19 spread in a region, inside a region. So the focus is on the asymptomatic subjects. It is a characteristic of this virus, and the possible containment strategies. So let's start from what we know already. What is the information that we considered in some way defined? First of all, some information about the average infection timing. We know the incubation period, more or less, the no symptoms phase, the infectivity period. And the second important aspect already mentioned is the presence of asymptomatic subjects. They can infect, they don't have evident symptoms, and they even don't know their condition. So we propose a compartmental model that tries to include these peculiarities. The models, the compartments that are common in all these kind of models, I will go very, very fast. The compartment of susceptible people, that are people not infected before. Then the compartment of infected, not infectious people. Sorry, here we are.
Okay.
And I think there is a little delay. Okay. So, and then the compartment here, peculiar of this spread. As I said, people infected, infectious, and then also can become recovered without even knowing to have had the virus. Then we have the compartment of diagnosed, isolated, and that may have very, very hard symptoms. And then, of course, the healed patients, the compartment of recovered. One thing that is common to all these models that we have seen also today is that we are trying, all of us are trying to identify models in which the control is already present. The control actions nowadays present are the prevention isolation for subjects that in some way are in a risky condition, for example, because some of their friends or parents got the COVID, so they must go to severe quarantine isolation. And then we have the other control action, the test, to check if a subject is positive or not, and therefore, after the test, the quarantine condition, he can go, if the test is negative, to the susceptible class. Otherwise, if he has a positive result, he is infected subjects diagnosed. Okay, then the third control is the one that we have all experienced, the contact limitations. It means that it has an effect of the contagious rate produced by limitations in contacts, informative campaigns, increased hygiene actions, and so on. So this is the block diagram. So we see a lot of parameters. Some of them are determined by the specificity of the population. For example, the newborn rate, the death rate, and so on. Some parameters are defined taking into account the specificity of the characteristics of this virus. For example, the incubation time, as we have seen, the infectivity time. Some other parameters must be identified directly on the real data. So let's see, these are the equations. We did a lot of math on these equations, so I will skip the details. I prefer to talk about the model parameters and their estimation. So let's start from the model parameters that can be determined by the ISTAT, in particular by the data on the specific population. For example, the per capita death rate, maybe I skipped the first one, the income rate of population, the natality rate, and the death rate. Death not caused by the infection. Then we have some parameters that are related to the virus, to the characteristics of the virus. And here I put again this scheme. So we have the incubation rate. We assumed more or less 6 days incubation. Then the symptoms onset, more or less 5 days. Then we consider the probability of negative tests. To decide this percentage at 0.84, we use the data from Protezione Civile. Then we have the negative quarantined individuals. If an individual is in the quarantined compartment and he did not do the test, after 2 weeks he can go back to the susceptible compartment. Then we have the rate of transition from the Q class after the test. Here we have chosen 2 days after the test, but from the presentation of this morning of the colleagues who had his mother recovered, we see that maybe this C number should be the days after the days we have the response to the test should be increased. But I see that the last days it is we talk about hours. Then there is a maximum number of tested population. It is also data, a parameter taken from the Istituto Superiore di Sanità website. And then you have some parameters that must be estimated from the data. In particular, the contagion rate, beta, that is influenced by the limitations in contact, by the lockdown. Then the per capita rate of recovery, the fraction of infected asymptomatic, that is what we are focusing on. Then the per capita rate of diagnosed patients. So they must all be estimated. Okay, the data used, as somebody said this morning, we have a lot of data. If you go to, I think everybody has visited the website of Protezione Civile, we see a lot of columns with many data. But to identify these 4 parameters, we used the daily number of diagnosed individuals currently positive. That maybe more or less corresponds to the what we have written on the right side, right column. Then the total number of recoveries among all diagnosed positives and the total number of notified deaths. These parameters, as I said, could be in some way correspond to what I wrote on the right column. Okay, so to identify beta, phi, mu ID, and gamma, the first idea we had was the simplest one. Let's try to do a least square estimation. But the data of the first period did not allow to do a good estimation of beta and phi together. They were scarcely identifiable. Maybe if we try together with the new data, the results should be more stable. And moreover, we notice that the mu ID and gamma strongly depend on this last two group of data. So to identify these 4 parameters, we consider a trial and error procedure that here I will show you. But before, we have to again point out that all the identification procedure must be done considering that the model that the data that we are considering are all controlled data. Because from, I think we can say from February 23, we have increasing containment properties up to March 11 with the lockdown. So the procedure we have considered is the first one. We fix a value phi in between 0 and 1. Then for each chosen phi, we estimated the other three parameters by the least square fitting with the real data considered. And then we evaluated the impact of the evolution of the disease. And if we stop now, what we find, again, we are talking about the data of the first period, we found this. So we found that in red you have, I think you see my mouse, in red we have the real data. And this is the corresponding to 24 February. This is 9 March and so on. And as you can see, we have more than one couple, beta and phi, that could fit more or less the real data. So here is the diagnosed patients and the not diagnosed patients. So if you just consider the real data of the total number, these ones, the total number of recoveries and the total number of notified deaths, there is, for the first data of that period, we have some problems. So we have decided to use another group of real data. Unfortunately, we don't have a lot of this kind of data, so they test on population. So we consider the fraction of positives, and here we are. And we consider the real data of Vo e Gagno, the small place in Italy in which tests have been done on all the population on February 22, 29, and March 5. And you can see that with the value phi equal to 0.001, for the right week, exactly the right week, we meet the third value of March 5. We have decided to consider this third value because of the delay in the identification of the positive subjects. So with this value, we obtain the fraction of positive subject close to the real value of Vo, that was 2.5% on March 5. So at this point, with this value of phi, we could estimate beta, mu ID, and gamma. Then we tried to see if the fitting was good. So this is the fitting starting from February 24. This is March 9 and so on up to more or less the first days of April. And this is the diagnosed current positive, the recovered patient, and the deaths. So the fitting appears quite satisfactory. But we wanted also to check how to use these results for the future. And these are the first results on prediction. And we can see if you increase the containment measures starting from 0.7 up to 0.9, of course the peak of the number of infected diagnosed and of the non-infected diagnosed, of course, lowered. And this could be interesting because the maximal number of, as I wrote here, of infected patients that need treatments and medical system is very sensitive to the isolation strategies. So in some way we can, by considering these isolation strategies, this U3 control and the corresponding maximum number of infected diagnosed and non-infected diagnosed, we can in some way manage the end of the lockdown. Okay, For this first part of our work, there are a lot of things to do, of course. Something is an ongoing work. For example, we are trying to to adapt this proposed model to the regional scale, and we are doing with some difficult because there is not an homogeneous conditions in Italy. So, for example, the contagious rate in Lombardia is really a larger value with respect to Lazio and with respect to the mean value in Italy. And moreover, one of the problems that we have considered is the lack of homogeneous real data. But as I said at the beginning, maybe in the last 2 or 3 weeks, the data have been collected in a more homogeneous way. Then the second part of my work in this period is the attempt to model the spread among regions. And in particular, we focus on the spread modalities and on the possible containment strategies. So, for this scenario, we considered a simplified model, the SEIR model, that in a first attempt well describes also the COVID, even if, of course, as we can see, the infected patients are considered altogether. And what is considered here are two SEIR models connected only by means of susceptible people and exposed ones, because we assume that if a subject is in a bad healthy condition, he would have not traveled. So the first thing we did was to identify the model parameters considering the data from China. At the very beginning, the only data we had from more or less January to up to February was only the data of about death rate and incubation time and so on from China. So by using the number of new positive subjects, we were able to identify more or less the data. There is some spikes here, but maybe we hope it was just a problem in data collection. So by using the beta parameters, the reproduction numbers estimated from the colleagues of China, we were able to identify the model in Italy. So this is the fitting from February 23 up to more or less March 17, and also to Lombardia. The problem with Lombardia was that appears clear immediately, because to obtain this fitting, we had to use a contact rate larger, significantly larger, with respect to the mean value that we used for Italy, that was practically equal to the one of Wuhan. So in Lombardia, effectively something was appears to be immediately more dangerous from the beginning. So once the model appears to be more or less well identified, we try to consider the impact of control measures. The first one that we considered was this picture, was the flight connection reduction. The first strong flight connection reduction dates back to January 30, and so we tried to establish what would have happened with an anticipated reduction and with a delayed one. If the reduction of the flight connection should have been anticipated to January 20, maybe we should have had some better results. I mean, the contagious rate should have been lowered. But if the flight connection reduction should have been delayed after January 30, for example, February 10, February 20, we would have not obtained too much damages. And because this is the reason that we think is that after more or less the end of January, a lot of reduction of mobilities, of containment of contacts were already established in Italy. And this fact, I've noticed this fact also when we try to apply the same strategies also in Italy, as we will see later. In this second picture, I propose something that I think we have already seen also today. What happened with the applied containment figures, containment measurements. So here we are, the real data and the simulated ones. So it seems a good fitting. And here, what would have happened without the lockdown? And has somebody this morning noticed that this difference represents a lot of people that could have died? And this is the scenario on 200 days. We have to notice that what we are showing here are just the first part of this course. Okay, then the last slides are about the spread among regions, and in this case we split Italy into 3 microregions. And note that the March region should have assigned to a center, but talking with some colleagues of Istituto Superiore di Sanità, they suggested that for the infection evolution, March is more similar to the north of Italy than to the center. So, okay, this is the conditions in Italy, and these 3 pictures are about the mobility reduction. As I said, I think already 2 times, we are trying to identify a model that is already controlled. The control is already applied, and this is a sort of cooling down in Italy. It's a website that from February 23 to March 27, for each small country tries to evaluate the reduction of mobility. Okay, so by applying this reduction of mobility and these 3 SEIR models, taking into account also the lot of mobilities from north to south in more or less in March 8, we have obtained this fitting, north, center and south. And I think that these 3 pictures are not so, okay, the fitting appears good, but I think this should be more interesting. This is the north of Italy, and this the first part from February 24 to April 14 are the real data and fitted by the simulated data. And then here we have the center and south. And I think it is interesting in this picture to note the dangerous condition of north of Italy. And as it has been observed by many speakers of today, in particular by Elisa Franco with her very interesting speech, I'm rather worried that also with a longer lockdown, the situation north of Italy will not recover so early. This is the curve. This one is the curve that we would obtain if the lockdown is prolonged also after May 4. So maybe some different strong measures should be applied. Okay, so this is some simulations for the possible phase 2 strategies. In this case, I consider 3 extreme strategies. For example, the first one is if we go on with the lockdown for 1 year, so it's rather impossible, of course, and it's not possible. Then we have phase 2, starting from May 4, with containments of about 30% without traveling, 30% assuming that today we have 100%, the most of all. And in green, we have the containment at 80% from May 23, other 2 weeks more from May. And the best thing, reasonable thing, way should be a reduction of containments only from May 23. So to this slide I add no comment since we all hope to end this lockdown soon. So, but all the simulations that we have seen today show the importance of avoiding wrong choices at this very moment. So my conclusions are in reality open problems. So we need more uniform data collections, and in particular more tests on to estimate the asymptomatic subjects. Yes, the estimation of our parameters phi has been made by just using the data of Euganeo, which is not enough. Then interesting problems should be the ones related with age structure modeling. It could be interesting to study the influence of age on the virus spread. And another open problem is the question. So is it possible a reinfection? So we hope no, but some experts say that maybe in September or October we would have the same problem again. We hope no, of course. So thank you again to Fabrizio for having organized this workshop. So if you have some questions, I'm here, or maybe if it's late, the next days, as you prefer. Thank you.
Thank you, Daniela. Thank you very much. Let's give her an applause. And do we have any question? I didn't have questions on the chat. But we had some discussion going on YouTube on the role of the compartment queue. So maybe you can clarify a bit this point, because people was asking, so the people in queue go into queue when they are found positive? I don't think so, because...
No, okay. No. People in queue goes, here we are. For example, when we wrote this model the first time, we were thinking about the people, the Italian people that came from Wuhan, and so they were sent to Cecchignola.
Okay.
So they were the people at risky, so maybe they were all susceptible. In fact, they were all susceptible. So they went in the quarantined compartment. For example, if some of us have some friends who has got infection, he goes to the quarantined compartment, and if he's lucky, they do the test, and in 2 or 3 days he can go back to the susceptible compartments. Otherwise, he has to wait 2 weeks, more or less.
Okay. That was my understanding, by the way. So it was clear, but there was a discussion going on. So I said, let's clarify it.